So, like people here, most of us would like to migrate to Ghana or even, come and stay there permanently. Especially some of the elderlies, like my dad or my mom, they would like to come and stay there permanently. And one of the things that comes to mind is the healthcare system. So when they come there, they're thinking like, are we gonna be able to get the same healthcare system like we had in the Western world? Can you speak a little bit about this on in terms of diasporas moving to Ghana and what kind of services they can get? Would you be saying that you have a lot of confidence in the Ghana healthcare system and we can move there and enjoy the same benefit that we do in Canada, US, and the UK?
So overall, yes, it's getting better.
All right. So, hello everyone. Today I have Dr. Victoria Ansah from Ghana, and currently she's working in the healthcare system in Ghana. And today I wanted to bring her here to talk about the Ghana healthcare system. And I think she's one of the most qualified doctors that I can find in Ghana to speak about this subject. So, Dr. Victoria, the floor is yours. You want to introduce yourself, where you went to school, and what you're currently doing?
Okay, hi, Kwabena. Very excited to be here on your platform. Hi, everyone. My name is Victor Ansah, Dr. Ansah. I actually started school here in Ghana. I did my kindergarten and primary school
Okay.
at Martyrs of Uganda. That was in Kumasi. So
Okay.
most of my life, I've been in the Ashanti region.
Okay.
Yeah, so I did primary school
Mm-hmm.
in Kumasi, and then I did half of my junior high in
Mm-hmm.
Martyrs as well. And then I moved to Cambridge
Okay.
International School. So
Mm-hmm.
that's where I did JHS 2 and 3,
Mm-hmm.
exciting times. And from there, I moved to senior high school, Yasantua.
Okay.
So in Yasantua, I was into a lot of clubs. I was into Debaters Club
Mm-hmm.
and SRC, entertainment, apart
Mm-hmm.
from studying. So it wasn't just all work,
Yeah.
wasn't just all studying.
Mm-hmm.
And I actually made it into medical school.
Wow.
And so I graduated from Kwame Nkrumah University of Science and Technology,
Mm-hmm.
also in the Ashanti region, Kumasi,
Mm-hmm.
one of the best medical schools. So yeah, um, we did 3 years,
Yeah.
which took us through the basic sciences
Mm-hmm.
at the KUST, and then we continued with 3 years at
Yeah.
Konfanochi Teaching Hospital.
Okay. But now, I think my next question to you is, can you give me or the audience a brief overview about Ghana healthcare system? Is it a pay system or is it a free healthcare in Ghana?
Um, so it's
Okay.
currently not a free healthcare. So um we have rural, so it's like
Mm-hmm.
district hospitals, they
Mm-hmm.
have regional hospitals and the
Okay.
national, yeah, we have the tertiary centers.
Mm-hmm.
Now there's what we call the National Health Insurance System
Okay.
that works in majority of the government health facilities.
Okay.
So, they cover basic illnesses, malaria,
Mm-hmm.
hypertension, diabetes.
Mm-hmm.
But sometimes not all the medications that they're able to cover.
Okay.
So when you have the National Health Insurance System, at least it gives you
Mm-hmm.
access to
Okay.
the basic healthcare.
Mm-hmm.
But if it's advanced, then that is when it's a bit complicated. You might have to gather funds,
Mm-hmm.
and like healthcare is not it's not cheap. It's
Right.
not cheap.
Right.
I mean, everywhere in the world it's
Yeah.
very capital intensive. So
Mm-hmm.
I do understand where our healthcare system is.
Mm-hmm.
Yeah.
Okay, so
So
it's not
definitely.
free, but if you have the insurance, you can actually go to a government hospital and you'll be taken care of your basic
Yes.
needs.
Yes.
Okay.
Yes.
So
Yes.
on that note now, what are some of the challenges that Ghana healthcare system is facing? And not just Ghana alone, everywhere you go around the world or the globe, everybody has your own challenges. But currently, what is the Ghana healthcare system? What are some of the challenges that you're currently facing?
So we actually have a lot of challenges here.
Okay.
From the no bed syndrome
Mm-hmm.
to our, like the system in general.
Yeah.
Even healthcare workers, our attitudes,
Mm-hmm.
our demeanor,
Mm-hmm.
ethical, and I think majority is us not having modern healthcare system in the
Mm-hmm.
district hospital,
Mm-hmm.
because there are a lot of healthcare services that can be rendered in the districts. They
Mm-hmm.
have to come all the way to the urban center like Accra. Like if you need a basic CT scan, you can't do it in the districts.
Mm-hmm.
You have to go to Kumasi, you
Mm-hmm.
have to go to the city. So
Mm-hmm.
um yeah, and I think another one is not being able to
Mm-hmm.
have a very functioning healthcare, where they
Yeah.
actually streamline healthcare workers as against the herbal medication.
Okay.
So it's they are not being regulated, honestly,
Mm-hmm.
which has a huge toll on our system.
Mm-hmm.
So during my master's, I got to speak with patients, not even just during my master's,
Mm-hmm.
throughout my healthcare journey. I talk with patients and I
Mm-hmm.
discuss with them, and they seem more to be in tune with the herbal medicine because
Okay.
um, we don't. So one of the challenges is we don't have the local manufacturing of the medications to
Mm-hmm.
is on the low.
Okay.
So most of the drugs we have to import,
Okay.
which is expensive, and the patients, if they are not able to pay, go through the herbal medicine route, not the ones which are regulated, like the drug peddlers,
Yeah.
promising them
Yeah.
that they can cure their hypertension, they can cure
Yeah.
their diabetes,
Mm-hmm.
and then they come back and they come with stroke,
Okay.
come with heart attack. They're dying, and
Mm-hmm.
so I feel a lot more has to be done in terms of sending at least more modern equipment
Mm-hmm.
into the district setting. At the same time,
Mm-hmm.
specializing healthcare personnel, healthcare workers to
Mm-hmm.
also undertake those tasks
Mm-hmm.
as well. You can't just send these modern equipment without
Yeah.
training the necessary people.
Mm-hmm.
Our ambulance system when I was in the district was poor.
Yeah.
Currently, since I don't work in a district, I don't know how it is right now, but
Mm-hmm.
patients used to die en route
Okay.
because that time you needed money. When we called an ambulance, they needed patients to have money,
Yeah.
and in the district, people are poor. It's something that I think it it eludes the average Ghanaian living in the
Yes.
city.
Yeah.
But in the village, you actually see people who cannot even buy ORS for their kids or for
Mm-hmm.
themselves. It's
Mm-hmm.
so whenever we call the ambulance system to come in, they
Mm-hmm.
didn't have money. Sometimes as healthcare workers, we had
Mm-hmm.
to contribute so that the patient could be taken to the tertiary center
Right.
for more care. But I believe that with the new ambulance that was in the system, hopefully that gap
Mm-hmm.
um, has been lessened. And
Okay.
one of the other challenges is our ignorance.
Okay.
The typical Ghanaian doesn't really care about their health.
Okay.
They don't want to spend on their health. So when they
Mm-hmm.
come to the hospital, they are supposed to pay for some services they
Mm-hmm.
don't understand.
Okay.
Yeah, because they haven't traveled to see what the other countries actually doing and what's actually it involves. And so
Mm-hmm.
you have some of these patients, even when they're hypertensive,
Mm-hmm.
they go ask their uncles or their aunties who are hypertensive
Okay.
what medication is working for them.
Okay.
Okay, is it like, let's say example like Sinopro? Okay, that's what I'm taking.
Okay.
They don't know how to come for regular checkups.
Mm-hmm.
So I think that gap can be lessened with healthcare education, and that is what
Okay.
I am so passionate about.
Mm-hmm.
So even in the consulting rooms,
Mm-hmm.
even if you have limited amount of time, you
Mm-hmm.
educate the patient, because
Yeah.
majority of Ghanaians do not actually know about our health, don't know about the
Mm-hmm.
causes of majority of the illnesses.
Mm-hmm. Mm-hmm. Mm-hmm.
Yeah, so
Oh
those are
wow!
some
So
of
those
the
those
things
are
that
some
I
of
think.
those are like real challenges that you have really highlighted. So thank you for that. But on that note, I mean, every negative there's also a positive component to it. So during your span of your career, what are some of the major milestones or some of the accomplishments the government has put in place. For example, when I was in Ghana during March 2020, I know the government managed the COVID really, really, really well. So, what can you speak on the positive note or positive side about Ghana healthcare and what has government has done, or even the private sector have done to really improve the healthcare sector in Ghana?
So I think when COVID,
Yes.
during the COVID era, we had to step back and we realized that even in the Western world
Yes.
that had exceptional healthcare system,
Yeah.
we're just going under. And that's when we realized that, we don't, I mean, we hardly even have ICUs in every health center. So we
Right.
had to take a step back and, really try to figure out how best we can
Mm-hmm.
to actually curb the COVID-19. So government, came into place, and the government of Ghana actually did well. So
Yes.
from the
Yeah.
airports, the
Mm-hmm.
screening, putting measures into place,
Mm-hmm.
Ghana Health Service made sure that, they were training healthcare workers day in, day out. I was part of the team last year,
Mm-hmm.
how to don, how to get out of your gown,
Mm-hmm.
how, like educating us on the case presentations.
Mm-hmm.
And basically the general public as a whole wearing masks, shield, washing of hands, social distancing. And
Mm-hmm.
it's more with the education,
Mm-hmm.
education and actually training healthcare workers to be
Yeah.
abreast. And one thing that they did was, trying to supplement the healthcare workers. So in a way,
Yes.
motivating.
Mm-hmm.
Although us being healthy was, motivating, because if the cases become overwhelming, we are
Yeah.
all going to be overwhelmed.
Yeah.
Yeah, but they tried to put in these measures
Mm-hmm.
so that we wouldn't be like what happened in the UK and most of the
Yeah.
European countries as well. So for that,
Right.
yeah, they did well. We
Yeah.
still have our challenges, but overall, we did exceptionally well.
Excellent. Excellent. So I think one of the questions, especially people talking about the Western world, what comes to mind is that we take healthcare for granted. For example, in Canada, I live here, and anytime you go to the hospital, you're well taken care of. All your blood tests, your CT scan, whatever needs to be done is done. So, like people here, most of us would like to migrate to Ghana or even, come and stay there permanently. Especially some of the elderlies, like my dad or my mom, they would like to come and stay there permanently. And one of the things that comes to mind is the healthcare system. So when they come there, they're thinking like, are we gonna be able to get the same healthcare system like we had in the Western world? Can you speak a little bit about this on in terms of diasporas moving to Ghana and what kind of services they can get? Would you be saying that you have a lot of confidence in the Ghana healthcare system and we can move there and enjoy the same benefit that we do in Canada, US, and the UK?
So overall, yes, it's getting better.
Okay.
Yeah, throughout my 10 years of being a medical doctor, I've seen worse. And I think with each year it gets better by, as I'm saying, we are improving our healthcare system,
Mm-hmm.
not just by building hospitals, modern hospitals, but it's like there's a lot of thought processes right now that currently goes into the healthcare system. So
Mm-hmm.
we do know that when we are bringing equipment such as state-of-the-art labs,
Mm-hmm.
and we are bringing the diagnostics, the CT scan, the MRI,
Mm-hmm.
it should come with people who are able to service this as well.
Mm-hmm.
So, like we are training people so that we don't have to bring someone all the way from outside the country to come and service it.
Right.
I mean, I can speak for the city in general. Like right now in Accra, if you want MRI, CT scan,
Mm-hmm.
is that easy. Within the next hour or two, you'll be able to have a CT scan.
Excellent.
In the district, I'm not so sure. But when it comes to, I remember you told me about one relative who wanted blood and it wasn't
Yeah.
easily available.
Yes.
So right now with the zip line, there are so many innovations like the drones and everything that's able to deliver these products.
Right.
So we are not 100% there yet, but
Right.
it is very encouraging. So even for the old folks, should they come, do they want high blood pressure medication, diabetes
Mm-hmm.
medication? It's
Mm-hmm.
easily available. It's easy,
Excellent.
yeah. I mean, they will get most of the drugs outside here in our market.
Mm-hmm.
The challenge is, when will we be able to,
Yeah.
manufacture most of these medications so that they are not so expensive.
Right.
So it's basically very well when you have money. When
Mm-hmm.
you don't have money, that's when sometimes it can be a bit tricky because not all the diseases can be managed by the national health insurance system. Yeah.
Excellent, excellent, excellent. So speaking on that, I mean, let's take another turn into the government or even the private sectors. I mean, what are some of the areas or some of the things that they can do to improve the healthcare sector in Ghana? And I'm throwing this
Um,
not just the government, but even individuals that want to invest there. What are some of the areas that, or some of the things that we can do to improve the healthcare system in Ghana?
so I think number one is invest.
Invest, okay.
Yeah, invest. I'm seeing people, the diaspora, Ghanaians living abroad,
Yeah.
coming with ideas like health technology,
Mm-hmm.
which is really going far. Building hospitals, but I think it shouldn't be centralized.
Mm-hmm.
That is my worry. Some of that has to go to the outskirts where,
Mm-hmm.
services are not easily available.
Mm-hmm.
So that is what we have to do. And I'm still waiting for your lab plan.
Okay, it's
Because
coming.
yeah, so when patients are not able to get, blood products, sometimes it's a bit frustrating. So
Mm-hmm.
I think all of that, you can actually help us with the
Yeah,
lab system. I mean,
yeah.
I know your work had in Canada, and you're doing exceptionally well. So
Thank you.
if you come on board with other healthcare professionals, set up state of the art lab.
Yeah.
um, you train healthcare workers
Mm-hmm.
just as you've been trained, so that we'll be able to manage that will be exceptional.
It'll be very
Yeah,
exceptional.
so it's more investment. And I think, so being outside the country, we are able to
Mm-hmm.
see what is it that they're doing. Okay, what are they doing right?
Mm-hmm.
And then we can be able to incorporate here.
Mm-hmm.
And initially, I think our healthcare professionals, the attitude
Mm-hmm.
wasn't really so. I wouldn't say for everyone,
Mm-hmm.
but there were lots of complaints from patients that,
Mm-hmm.
our attitude towards them wasn't the
Yeah.
best. But right now, we're actually getting that. People are coming early to work.
Mm-hmm.
um there's been a lot of training in terms of communication with
Mm-hmm.
our patients and our
Uh-huh.
clients. So
Mm-hmm.
it's getting better.
It's getting
And
better.
you have to treat patients in such a way that they would always want to come back.
Yes. Yeah, customers.
So
Yeah, customers or
yeah,
clients.
so I had patients who were so used to, their treatments in the UK and
Yeah.
in Europe, and then they come and go like, oh, okay, you're not treating me well. So, but
Yeah.
right now they can't actually say that. They come and they're so impressed.
That's
They come
good.
to our health the medical center, and they're like, oh wow, this
Wow.
is just like
Yeah.
the place I'm in Germany. This is just like the place,
Mm-hmm.
where I access my healthcare in
Mm-hmm.
France, in the US.
Mm-hmm.
And for me, I think it's just dynamite that we're actually getting there in terms of communication, in terms of um, leveling of healthcare,
Mm-hmm.
actually telling our patients what their illnesses is,
Yeah.
how they can manage it as well.
Mm-hmm.
Yeah.
Excellent, excellent, excellent. So another question that I have for you is, I mean, you talk a little bit about this already in terms of the people at the diaspora, including myself. What is your message to us, especially those in the healthcare sector who has really come to the Western world to learn the advanced method of healthcare? What would you tell us to do in terms of how we can help improve Ghana healthcare system? Would you encourage us to come and bring our experience, or what would you tell us or the audience?
Yes, please come and help.
Okay.
Yeah, it's hmm. it's paramount. As I said, we are improving, but we are not there yet.
Okay.
And for the healthcare system, it's really capital intensive. So I believe that, I mean, you guys are making so much more. Don't say I'm wrong.
Okay.
um, yeah, it would be great for people such as yourself coming together and seeing, what are some of the gaps that can be addressed in our healthcare system. So if it's, let's say, the health education and communication, what are some of the strategies that are helping?
Yes.
And we actually need more researchers,
Research.
and we are
Okay.
getting the, yeah, because I found out that sometimes not all research that works in a particular place works here. So we need brilliant minds. We have
Yeah.
some here. We need people who have an open mind, coming down, just helping, investing, putting resources together. And the return is going to come back eventually, because if we have all of these hospitals and labs,
Yeah.
people are definitely going to come from outside the country.
Yeah.
I mean, you don't, so if someone in any part of West Africa wants, let's say, a kidney transplant or a liver transplant, they don't have to travel all the way abroad. I mean, look at the
Yeah.
expenses, flights, and accommodation and everything. That can be invested here in Ghana. There is a
Yes.
lot of prospect in Ghana. So I do encourage Ghanaian healthcare workers working outside that please don't just stay outside, just try and come and help as well.
Thank you. That's good. That's a good one. That's a good one. That's a good one. Victoria, this has been really a blessing to really speak to you about Ghana healthcare system and the current situation. I really, really enjoy my time, and I really also learn a lot from you. So thank you very much for your time, and all the best in everything that you do. Psychology in a different way to live.